our 7th annual pinning ceremony. This ceremony recognizes the achievement of nursing students who are completing their requirements for the baccalaureate and the associate degrees in nursing. Dr. Robert Reed, University of Southern Indiana Vice President for Academic Affairs, will bring greetings from the university. Dr. Reed.
Thank you, Dean Boudreau. It's my pleasure to be here to represent President Luke's Board of Trustees on this occasion marking the accomplishments of the 1996 nursing graduates. On behalf of the University of Southern Indiana, I welcome the families and friends of these students to this ceremony. USI is committed to educational excellence, and USI's success in achieving those high standards is demonstrated by the outstanding achievements of the graduates we are recognizing here today. Graduates, in celebrating this milestone in reaching your goals, we know that you will continue to commit time and effort to further your ability to optimally care for your patients. The University of Southern Indiana is committed to assist and support you in those efforts, whether they be at the undergraduate, graduate, or professional continuing education level. Graduates, we are proud of you, and we wish you success in your profession, and we wish also the satisfaction that comes from a field that makes such a difference in so many lives. Thank you.
Also with us that I would like to recognize is Mr. Bruce Baker and his wife Carol. Mr. Baker is chairman of the Board of Trustees here at the university. Will you stand, Bruce and Carol? Thank you for being here. Their presence recognizes the support that this school and the nursing program has received from the Board of Trustees and the University Administration, and I think all those who make up this special university. Well, in addition to welcoming parents, friends, family, I also want to extend our appreciation to you. The support and help you have given these graduates has been very important to their success. Each of you in their individual, personal, caring ways, sometimes known only to the graduates, and sometimes perhaps not even known to them, have made a difference and have contributed to their achievements and accomplishments. Without your support and love, these graduates would not have achieved the success which we celebrate today. Thank you for that help. When the University of Southern Indiana Nursing Program was established in 1988, the founding faculty made a commitment to teaching and practice excellence that would ensure that USI nursing graduates would be known for their clinical practice expertise, their caring, and their professional value system. To accomplish that goal, it was clear that the two essential ingredients would be needed. First, it would require the selection of high-ability, dedicated students. Second, it would require a faculty who could teach, practice with excellence, and serve as professional role models for the students. In a few minutes, we will honor you, the students, who have achieved these high standards that were set for this program. But first, I want to introduce to you the nursing faculty. The faculty who are knowledgeable practitioners of nursing, excellent teachers, and individuals who care very deeply about their students. Faculty, please stand as I introduce you and identify your teaching and clinical areas. Connie Cooper, Community and Clinical Wellness. Linda Ebinger, Psychiatric Nursing. Penny Fuchs, Medical Surgical Nursing. I do want to say a special thank you to Penny for her efforts in coordinating this afternoon's ceremony. Cynthia Goodwin, medical surgical nursing. Cynthia was one of the faculty who joined me in 1988 in initiating this program, so the accomplishments of this are certainly shared to a great degree with Cynthia. Katie Graw, parent-child nursing. Dr. Sheila Melander, critical care nursing. Michael O'Grady, medical surgical nursing. Gina Shar, parent-child nursing. Julie St. Clair, community health nursing. Marianne Weaver, medical surgical nursing. Ann White, undergraduate program coordinator, medical surgical nursing. And in the back, I would like to recognize Deborah Bookout, who is our nursing health profession student affairs coordinator. Debbie is a friend to these students and is such a wonderful support to the faculty. Her helping at the door is very typical of her getting the job done regardless of what that takes. So Deborah, thank you. On behalf of faculty and students, I also would like to say a special thank you to Barry Shar, our pianist today, who is the husband of nurse faculty Gina Shar. And oftentimes, just as you've asked a great deal from your family members, faculty likewise reach out and ask for the talents and support that they can provide. So thank you, Barry. Please join me in expressing our thanks to these very special people. Looking back, I don't think I recognize Dr. Judith Paulstad, who is a very special person on our faculty. I'll get to Judith next up. Thank you. Our speaker for today's pinning ceremony is a special nurse person, Mary Beth Ladato. Mary Beth Ladato earned her bachelor's degree in nursing from the University of Evansville, a master's degree in perinatal nursing from Indiana University, and is currently enrolled in the Frontier School of Midwifery and Family Nursing. Ms. Ladato has practiced nursing as a staff nurse in the high-risk nursery at Wellborn Baptist Hospital, and the special care nursery in labor and delivery at St. Mary's Medical Center. She initiated and developed the first perinatal outreach program for transport referrals at St. Mary's Medical Center, and has practiced as a clinical nurse specialist in children's services. Currently, Ms. Ladato is a maternal child nurse practitioner and clinical manager at the Deaconess Family Practice Center. She is a member of the American College of Nurse Midwives and the Red Cross Nurse Registry. Ms. Ladato's commitment to her continuing professional development, her leadership in nursing, in the community make her an excellent example of nursing excellence. I've known Mary Beth for a number of years and have watched her make that kind of commitment that I have tried to also set for you, a goal of being of service and continued learning. So it's a very special privilege for me to introduce to you Mary Beth Ladato.
Graduation from the School of Nursing. Now, I hope all the smiles and all the energy I'm feeling here has more to do with looking forward to an exciting career and future, and not simply relief over completing the last of the final exam and that last patient care setting. And I hope you didn't come here today believing I can predict your future and the future of nursing, and what is the best job or direction for you to choose. Because I left my crystal ball at home, and it's not been much use lately anyway. Just about the time the healthcare industry and schools of nursing and medicine think they know what direction to take, the geography changes, and we find that there's a river where there used to be a road, much like your 3 river road right now. share with you what I believe has helped me to grow and succeed in my career as a nurse and my life as a woman. The principles I live by fit both of my roles, and they allow me the security that I need to feel safe in turbulent waters, both at work and at home. First, I believe that I am lovable and capable. If I set my sights on a goal, and I prepare adequately and work diligently, I can accomplish that goal. Henry Ford once said, if you think you can, or you think you can't, you are right. If you take on the role of the victim, you will feel victimized. If you believe, as Stephen Covey does, that the control each and every one of us has is in our responsibility, then you will see all things as possible. You may not always control the circumstances around you, but you can always choose your response to those circumstances. And your responses will either result in making you a happier person or a miserable victim. Take the story of the eternal optimist and the eternal pessimist. Two young boys, age 6, are placed in a room full of manure. The eternal pessimist sits and cries all day long because he's miserable. He has nothing to do, no toys to play with, and he got himself such a raw deal. The eternal optimist, on the other hand, has a smile on his face and is diligently digging through the manure, saying, with all this horse manure, I know there must be a pony in here somewhere, and I'm going to find it. Again, we choose. Secondly, remember, you are never alone. No man is an island, and it is our interconnectedness that gives us strength. God never meant for man to live alone, isolated from each other, wallowing in self-pity and/or instant gratification. For it is in our doing for others and working together that we feel fulfilled and that we build our family, our community, and our profession. When we encourage and support each other and push each other forward, well, Mother Teresa in all her wisdom tells us to spread love everywhere you go. First of all, in your own house. Give love to your children, to your spouse, to a next-door neighbor. Let no one ever come to you without leaving you better and happy. A living expression of God's kindness. Kindness in your face, kindness in your eyes, kindness in your smile, and kindness in your warm breathing. In these words lies the essence of the profession of nursing. As you give, so shall you receive 100-fold. Third, follow your dream. If you see yourself doing some kind of nursing care that is not yet available in your community, but you feel the need is there, go for it. Never give up. One of my current instructors in Nurse Midwifery, Kitty Ernst, a very great lady indeed, told us at a recent workshop, do what is right. Don't do the right thing. Doing the right thing is what has created many of the problems we are seeing in healthcare today. Many people do the right thing, often meaning the right thing to make a lot of money, to build a monopoly, not necessarily the right thing for the health care of the people. If you cling to doing what you know in your heart is right, you will be undaunted. Take, for example, back in the early 80s, support for parents suffering the loss of a baby by miscarriage, stillbirth, or neonatal death, was almost non-existent. When we lost a baby in a special care nursery at St. Mary's, we basically said, sorry, too bad, but you're young, you can have more than that. Be glad it didn't live a much longer time than that. That would be so much harder. Ha! If we only knew. We did not know how much we could have done to help our clients, and we felt like failures ourselves. So we figured the quicker it was over and forgotten, the better. I had the good fortune to attend a workshop about helping parents suffering from such a loss, and I was convinced that educating our nurses and physicians about perinatal loss could make a tremendous difference for families in healing and recovery after such a traumatic event. This discovery of how to improve our care to these parents quickly became a passion for me, and with the help of some good people and parents who themselves had suffered at our hands, we developed an entire perinatal review program, including a parent support group called SHARE, which still exists today. This, however, was not accomplished easily. I first had to convince my nursing colleagues, as well as the physicians and administration, that there was a need to change was not gross and awful, but was a natural progression, as was the grief that followed, and that we were in fact making the loss more difficult by our insensitivity and lack of understanding. At first everyone was aghast, and every death was pretty much left up to me. I came in day and night to help. I took pictures of these little babies and encouraged the families to hold and cuddle their babies and share their grief. When the parents began to respond, and were so grateful for the help and support, the staff and physicians began to respond as well. Suddenly, everyone saw the need and felt every parent should receive this kind of care. And so it continues. Again, do what is right. Finally, remember that what you have in your hand at the end of graduation is not an ending. It is not recognition for the completion of your education. It is an invitation to join a profession at the very basic entry level, and then to begin a lifetime of learning, and hopefully for most of you, to further your education. You are no longer being educated for a job in the hospital. You have been educated to begin a career as a nursing professional. You do not have the luxury I had when I was graduating 20 years ago, to visit the 3 hospitals in town, choose your unit and area of interest. Today you must be versatile and ready. You must make your own opportunity, and you must think outside of the nurse at the bedside alone, because the beds are at home now, or in the surgery center. The patients are clients in need of independence and responsibility for their health care. You will not be the coordinator and implementer of health and wellness care. You will be the facilitator of health, wellness, and recovery. You will quickly find that 2 or 4 years of university education alone cannot prepare you for the job ahead. You must now focus on my very last message if you are to survive and flourish. The final message here is an acronym for LEARN, L-E-A-R-N. This is an acronym I hope you will carry with you always. L, listen to your clients. Put out the actionable message to your clients and remain open to what you will learn from them, and develop the ability not to be shocked. Shock is certain to be a conversation stopper. Like the day the 15-year-old came in my office, pregnant, and unsure who the father was, and then proceeded to tell me that she didn't know who the father was because she had been with 7 women one night at the hotel, and had been with all 7. It was shocking to me, but I tried to remain calm and did everything I could to keep from letting my jaw hit the ground so that she would hear what I did. Remember, anger is a form of communication. It may be hard to hear, but it is more informative than silence. And think about how you present information. Human beings believe the nonverbal when the verbal message does not agree with your body language. E, erasing control helps prevent burnout. It puts the whole job back in perspective, makes us more effective, and puts the power where it needs to be, back with the client. Developing the following symptoms of inner peace will carry you a long way in implementing good patient care and still protecting yourself from over-involvement or burnout. Number 1, an increased tendency to let things happen rather than make them happen. A loss of interest in conflict. A loss of interest in interpreting the actions of others. A loss of interest in judging other people. An unmistakable ability to enjoy each moment. Frequent attacks of smiling. An inability to worry. And frequent overwhelming episodes of appreciation. Increased susceptibility to the love extended by others, as well as an uncontrollable urge to extend it. A, assuring continuity. The more continuity there is in healthcare, the more effective it appears to be. This does not mean only one provider can see a client. It is a practice philosophy. The overall expectation is that there will be follow-up on testing, that continued resources will be shared for problems identified by the client and provider, and that the healthcare facility will be treated like a valuable customer, worthy of getting his or her money worth. This continuity focuses the attention on the client's responsibility for self-care, health maintenance and promotion, and periodic screening. It is the feeling tone of the clinic figuring out how things fit, what can be seen in the lab, and how the body ticks. Without this follow-up and follow-through on testing and client progress, you will never become advanced in your knowledge and ability as a diagnostician and clinician. That is part of the prototype over which no one has control but you. And networking for the client and for yourself as a provider. It's the telephone call, the delay of professional support groups, which provide the cutting-edge care and education for your client and you. It is seizing the opportunity to learn the rationale for a certain diagnosis or recommended treatment by the specialists who care for patients you refer. This is also where you excel in your ability to guide others towards resources, other professionals, and support groups which will help them in their journey towards maintaining or achieving health. We cannot do it alone. No single healthcare provider has all the answers. It will continue to take all of us and our collective knowledge to continue advancement and improvement in healthcare. Do not let yourself be locked into a single focus on healthcare and nursing opportunities. The world is yours, but you must continue the process of educating yourself so that you will remain marketable in this ever-changing healthcare arena. You can no longer expect high-paying jobs with only 2 or 4 years of basic education. If nursing is to stand shoulder to shoulder with every other degree-based profession, we cannot stop where we are. The ultimate proof after your RN does not make you a better person, but it can help prepare you to feel less threatened by the rapidity of change and make you ready for any challenge you might face. For it is in further learning that we realize how much we don't know, and that saying, "I don't know," does not absolve you from responsibility, but rather requires that you find out if you plan to remain involved in the job at hand. And as I close, let the words of Florence Nightingale burn in your hearts forever as it has in mine, when she says, "As for education, let us never consider ourselves complete." Thank you.
Mary Beth, thank you for your sharing, your wonderful example of professionalism, and the challenge that you offer to these graduates today. Robert Mobley, who's president of the District 4 of the Indiana State Nurses Association, is not able to be here, but he asked for me to extend to each of you his congratulations on behalf of the district and an invitation and a challenge to become part of this profession for which you have worked so hard, and to join and become a part of the American Nurses Association, the Indiana State Nurses Association, in whatever district you may live in. Leadership is an essential aspect of nursing, and professionalism as we see it in many areas of our practice. I'm pleased at this time to introduce 3 outstanding graduates who have served as leaders during the nursing program and who will speak to us on behalf of their classmates. The first speaker is Donna McCutcheon, who will represent the Upper Division Evansville campus. Following Donna will be Deborah Boyne, representing the Upper Division students at the Vincennes campus, which is one of those special opportunities that this university has had opportunity in partnering with the Vincennes Jasper campus area. And third, Claudia Merkley, who is president of the Nursing Club 94 and will represent the students who are completing their associate degree in nursing.
Good afternoon. My name is Donna McCutcheon, and it is my pleasure as representative of the senior class to welcome everyone to the 1996 pinning ceremony. For many of us, this has been a road that is quite an amazing adventure. One thing is certain, we could never have made it alone. The faculty of USI, committed to excellence, education, and encouragement, has definitely helped us down the road. I came back, and I'm ever so grateful. USI supports us in so many ways. Our educators try to make class time convenient and available. This past semester, a system called Picture Tell enabled students from Vincennes to actively participate in a class in Evansville. I believe we should be proud of the nursing educators that we have had the opportunity to know and love. So many have continued to pursue their own education, and we have had the joy of sharing in their accomplishments of master's degrees and doctorates. What a wonderful inspiration to us all. For all of you who have taught us so much in the classroom and by your own lives, the senior class thanks you from the bottom of their hearts. Another group of people needing recognition is our families. How could we have balanced our crazy lives without you? For those men who now have dish-can hands and have completed Laundry 101, we thank you. For those children who have had to help around the house a little more and play a little less, Mom appreciates you. And for the parents and family members who have sent care packages, paid long-distance phone bills, and are present here today, what can we say? We love you all. And now to my graduating classmates, I have something to say. Some of us have worked in nursing for many years. Some are just beginning to work in this profession. I graduated from a diploma school in 1978, and I have seen a lot of changes. The word change is constantly linked to healthcare. But let me take a few moments to remind you of some things that never change. As nurses, we are a privileged people. We witness the miracle of birth. We hold the hand of one leaving this earth. We care for people experiencing pain they may never remember their name. We make a difference by what we do. Nurses, we are all so proud of you. Thank you.
Hello. I'm here today to represent the graduating class of 1996 from the Vincennes campus. I was there for my classmates to thank our faculty, Dr. Crudet, our dean, and all the other faculty who made endless trips, not fun, I know, to Vincennes. We appreciate the time you took to drive and the sharing of your knowledge. We got together and we hypothesized a little bit about this time, and we ventured to say that if we had to drive here 2 times a week, an hour each way and back, for a whole semester, we'd spend 80 hours alone in the car. That doesn't count any clinical time, it doesn't count any library time. We recognize and thank you for your invaluable service. We're here today because of it. We also realize that after having research, we need to prove that statistically, and we're going to find an unsuspecting junior in the back row to do that next year. We also like to thank our families. They respected our commitment of personal and professional growth. It was their understanding and encouragement that enabled us to be here today. We appreciate you and we love you. We also have a special thanks to Kathy Holscher. She's not here today, but she wanted to be. She's our clinical coordinator in Vincennes, and it's Kathy who enables the Vincennes students to put their newly learned theories into practice at some very quality clinical sites. She's also advised students, she lectures if she's needed, she coordinates exams, she wears many hats for us. Her flexibility, availability, encouragement, and example have helped us keep our professional, scholastic, and private lives on track throughout our school years. The gift that we'd like to present to school today are funds that we're going to donate to purchase a sign to be placed at the main university to help people find the newly relocated nursing department. Since we don't get up here much, it'll probably help us too. And in conclusion, we'd just like to take the time to say in an unsure profession of nursing right now, we're grateful for the faculty who instilled in us a continued need to change and care and commit to education. And we know that these things will help us find our way and help pave the way for new nurses to come. Thank you very much. Isn't it a great day? Yes. It's a day not only to stop and congratulate ourselves on the job well done, but it's a day to stop and to give reverence to the people and powers that have made this day possible. First, we'd like to thank you, our families and friends, for your love and encouragement. Because without you and your support, we would not be sitting in these chairs here today. Thank you. I'd like to give a special thank you to my loving husband, Ralph, who has proven to be one of the finest ironers of nursing clothes ever invented. And a special thank you to my mother, who, like all good mothers of nursing students, learn quick. She began each telephone call with, "Are you studying? Do you have a test Monday? Thanks, Mom, for keeping me in line." And to my sister, Sandy, who has had me on the 24-hour prayer line of her church for our weekly test, thank you. It was greatly appreciated, greatly needed. To the rest of my family, I'd like to thank you for your loving presence in my life. And to Isaiah, my 6-year-old nephew, yes, now I can come out and play. Second, we'd like to thank the University of Southern Indiana for giving us Dean Coudray and the finest faculty ever assembled. Your wisdom, knowledge, and guidance has created and molded the graduates you see here today. As we go forward to begin our nursing careers, we represent USI professionally, and we will strive to make you proud. And to the baccalaureates, we commend you on a job well done. You're a shining example and model of what determination can achieve. We, the associates, are proud to sit behind you today. And now, to my fellow graduate associates, it has been my pleasure to represent you as class president for the past 2 years. You're one of the finest teams I've ever worked with. Be proud of your accomplishments. And to those of you who have decided to begin your careers now and not return in the fall, please know you are loved and will be missed. We wish you the very best. It is my proud pleasure to announce that the graduating associates will present USI School of Nursing with an identification sign that will be placed at the main entrance on the second floor. It will read, University of Southern Indiana School of Nursing and Health Professions, and will be accompanied by the university emblem. We hope it will prove to be a proud reminder of the graduating associates of 1996. As you go forth and begin your nursing careers, I'd like to leave you with this message written by Barbara Smallwood. Whatever your mind can conceive and believe, it will achieve. Dream great dreams and make them come true. You are unique. In all the history of the world, there was never anyone else exactly like you. And in all the infinity to come, there will never be another you. Never affirm self-limitation. What you believe yourself to be, you are. To accomplish great things, you must not only act, but also dream. Not only plan, but also believe. Defeat may test you, it need not stop you. The greatest mistake is giving up.
Wishing will not bring success, but planning, persistence, and a burning desire will. There is a gold mine within each of you from which you can extract all the necessary ingredients. Success is an attitude. Get yours right. It is astonishing how short a time it takes for very wonderful things to happen. Now go forth and show us the colors of your rainbow. Thank you.
Thank you on behalf of the nursing faculty and the many students, visitors to our Health Profession Center that will enjoy the gift that you have made. And I would share with family and friends, there may have been a few times when the cookies weren't as available because some of this money was earned through cookie sales and baking sales and a lot of generosity, which is very typical of what I've experienced as I've gotten to know you as individuals as well as a class. Today's ceremony recognizes the accomplishments of the 7th class of the University of Southern Indiana graduate nurses. For our associate degree graduates, the ceremony recognizes the achievement of the core knowledge required for nursing practice and for advancement into upper division studies. You will be studying for the license exam this summer and begin your professional nursing career both as registered nurses and continuing students in many instances. For our nursing graduates who are receiving their bachelor's degree, we celebrate your completion of upper division study. The advanced theory and practice which you are completing will provide the additional knowledge and skills required for the complexity of today's healthcare system and the challenges of nursing with our increased responsibility for total care to patients. The achievement of the baccalaureate degree in nursing also is a basis for graduate study in preparation for advanced practice nursing as a nurse practitioner, a nurse specialist, nurse anesthetist, or nurse midwife. The nursing pin, which will be conferred today, is unique to the University of Southern Indiana's nursing program. The school's nursing pin that the students will receive is pictured on the front of your program. The pin with the backdrop of our state and city includes a book and blank, which symbolizes the knowledge and enlightenment. The rays symbolize the outreach of your expertise in caring, which you will provide to patients, families, and communities. Graduating nurses, with the conferring of this pin comes the responsibility of continuing the practice excellence and caring of the USI nursing graduates who have gone before you. Michael O'Grady, faculty, will present the class, and Ann White, undergraduate nursing program coordinator, will assist me with the pins. The graduates will be presented with the flower by Penny Cook.
We will first recognize students graduating with a Bachelor of Science in Nursing. Theresa Anslinger. Kimberly Ballsmeyer. Barbara Bartnick. Anne Birchler. Lisa Burge. Suzanne Elliott. Michelle Flanagan. Michelle Foster. Joyce Gore. Susan Farmer. Clara Hobbs. Kelly Jenkins. Nancy Johnson. Julia Overstein. Tanya Masterson. Isabella McCool. Donna McCutcheon. Deborah Melvin. Ruth Metzger. Susan Miles. Lynette Owen. Tricia Phillips. Lisa Powers. Karen Reffett. Laura Robbins. Sharon Shields. Sharon deserves special recognition as being named the State School Nurse of the Year for the state of Kentucky. Science in Nursing. Jennifer Barker. Kim Baumgart. Sandra Baumgart. Angela Bernard. Carrie Booker. Jennifer Gupta. Andrea Caldwell. Robert Castler. Lee Ann Copeland. Julie Cotter. Lisa Dawes. Kelly Dempsey. Mary Haley. Kimberly Carney. Brooke Georges. Tracy Erling. Barbara Hart. Mary Hawkins. Jennifer Ireland. Jane Burke. Lisa Jennings. Nina Keene. Alicia Keller. Rebecca Lee. Wanda McCarter. Judy McKnight. Claudia Merkley. Sarah Mindell. Rita Mitchell. Melody Montgomery. Elizabeth Moose. James Fender. Deborah Phelps. Tricia Plank. Tina Powers. Donna Regalon. Jennifer Russell. Sue Schmidt. Susan Seibert. Jamie Seavey. Christina Small. Stacy Stamps. Brandy Thacker. Wendy Williams. Nicole Woods. And Robin Zinn. Ladies and gentlemen, honored guests, please join me in recognizing the nursing graduates of 1996.
Our most sincere congratulations to each of you. Now, Mary Ann Weaver and Linda Evinger will proceed with the lighting of the candles. Each of the graduates will light their candles with the light of the candle symbolizing the knowledge and caring that you have achieved and will send forth. Graduates, please stand. Any nurses who are present in the audience to stand and join with the faculty to stand and graduates in reciting the pledge to the profession, and that is in the program. So nurses in the audience, and I know we have some, I know a mother and a few others that are nurses of the graduates. Okay, thank you. I solemnly pledge faithfully do all in my power to maintain and elevate standards of profession and nursing, to dedicate myself to the welfare of those committed to my care. I will endeavor to upgrade standards of nursing care by continually striving to increase my knowledge as I coordinate care with the physical and emotional well-being of those for whom I care. Graduates, be seated. I want to again say thank you to family, friends, supporters of our program for your presence here, and want to invite you to join after the recessional with the reception, which is behind the blue curtain. Faculty and students will recess, and then we will adjourn into the reception area.